Hello, here's a narration on YouTube of the cardiovascular system and blood disease section. I'm going to hit the highlights of this section. As usual, those I feel you should, let's say, have as a take-home message from this unit of the class. Please note that this same PowerPoint is available non-narrated, so you can look at it undisturbed, let's say, anytime you like, and you can come back to this anytime you like to perhaps to hear my pearls of wisdom. Here are the objectives that I have for this section for you. Again, you can read it, but you should be able certainly to know basic terminology. Hopefully you remember it from medical terminology and other courses you've had. Describe key characteristics of the diseases of the arterial circulation and the heart, and also some genetic diseases such as sickle cell anemia that involve the cardiovascular system. And then the diagnostic tests, etiology, signs and symptoms for various diseases as well. Here are some of the diagnostic procedures for cardiovascular disease: auscultation, which the practitioner listens to the sounds of the heart, and so forth. You can take a look at these descriptions of these various procedures in your textbook. All right, an aneurysm. Aneurysms involve blood vessels. They are blood vessels basically that dilate and whose walls are weakened, and of course when these rupture, or if these rupture, they can cause serious disease and complications and unfortunately often death. Aneurysms are most commonly located in the abdominal arteries and in cerebral arteries as well. Here is a diagram of a cerebral aneurysm. You can see that if this vessel broke, it would greatly deprive large areas of the brain of a blood supply. Certainly very debilitating and, as I say, often fatal. Hyperlipidemia, which means increased level of lipids, cholesterol in the blood. Some hypercholesterolemia is inherited, and for those conditions, some of the preventive measures may not be as effective or may not be effective at all, and medication usually always is required in the case of familial or inherited hyperlipidemia. So this explains it and what cholesterol is, and we'll go on to see what these are. So there is a distinction between what we call LDLs, or low-density lipoproteins, often known, quote, as the bad lipoproteins, high-density lipoproteins, often known as the good cholesterol. However, more and more medical information is pointing to the idea that total cholesterol is an extremely important factor, and perhaps equally as important, if not more, than the ratio of HDLs to LDLs. Some medications that claim to elevate HDLs may not actually be serving you as well, or serving the patient who takes these medications as well as was once proposed. All right, and this another definition of triglycerides as well. Any of these higher lipids in the blood, high triglycerides in the blood, are definitely risk factors for coronary artery disease. Arteriosclerosis and atherosclerosis, these are both diseases of the arteries, closely related. Arteriosclerosis is sometimes called hardening of the arteries. The affected arteries cannot stretch and rebound in response to blood pressure. And of course, this can cause serious problems, complications, high blood pressure. And as I mentioned, arteriosclerosis can lead to hypertension. And the most common cause of arteriosclerosis is atherosclerosis. So atherosclerosis can lead to, and most often does lead to, arteriosclerosis. Atherosclerosis refers to the buildup of cholesterol in the coronary and other arteries, which can lead to the hardening that I've just mentioned. All right, here's a little more. The lesions associated with atherosclerosis are of three types. And there are diagnostic tests, which include EKGs, angiography, and CT scans. And symptoms can be severe or not noticed for many, many, many months or even years, depending upon where the occluded artery is located and how occluded it is, how much it restricts the flow of blood. What can you do? Control blood pressure, reduce cholesterol. Lifestyle changes often contribute very significantly to the treatment and, better still, the prevention for some coronary artery disease prevention. In other words, adopting a healthful diet and good exercise program before symptoms occur is really the best method to maintain health. So hopefully you will do this for yourself and your clients. If not, of course, there are medications, and often even after the fact, once coronary artery disease has occurred, often a change in lifestyle, such as improving diet, losing weight, having a regular exercise program, will certainly, even in some cases, reverse heart disease. This is what an occluded artery and clotted blood can look like. So you can see, of course, the impediment of blood flow to the coronary arteries. This lining, inner lining of the vessel, is called the endothelium. Many factors can irritate the endothelium, and as the endothelium is irritated, generally it will begin to develop plaque. Okay, and diet and exercise, proper diet and exercise will go far to diminish the development and severity of these conditions. Hypertension, high blood pressure. We have to look at both the systolic blood pressure, which is the pressure when the heart is contracted, and the diastolic pressure, which is the pressure when the heart muscle is relaxed. And you can read what the definitions are. Some of the exacerbations for hypertension are advancing age. All of our ages will advance, but other things that you have more control over are sedentary lifestyle. You can become more active, you can reduce weight, you can reduce excessive dietary salt and alcohol intake, and also smoking. Smoking is a major factor contributing to hypertension. Family history, sometimes ancestry, which perhaps you don't have as much control over. Notice that 20% of adult population worldwide is affected by hypertension. It is considered a major risk factor for heart disease, stroke, and kidney disease. In the brain and the kidneys, small blood vessels can actually become damaged and burst due to the pressure, higher pressure of blood flowing through them. And of course, this will result in serious disease. All right, so here's the difference between primary and secondary hypertension. Take a look at these definitions. And here are some of the normal ranges for blood pressure. If your blood pressure is 135/85, your risk for stroke and heart disease increases 2 times. If it's 175/105, your risk of stroke or heart disease increases by 8 times over normal blood pressure. All right, here's just take action to reduce your blood pressure and save your life. Here's some of the actions that you and or your family, patients, clients can do. All right, here again is the definition of normal versus hypertensions. There are some films on Moodle for how to take vital signs. Please take a look at that, how to treat hypertension. And I think we've gone over some of this before, as I mentioned previously, but take a look, read this, and clarify any of these. We have touched on them just a moment ago. Coronary heart disease. The heart is a muscle itself, and it receives just about 5% of the large volume of blood that flows through the atria and ventricles. The coronary circulation supplies the heart with its own supply of oxygen-rich blood, and these vessels can become occluded or narrowed, as we just looked at. Continued ischemia, which is lack of blood to the heart muscle, can result in a heart attack. or myocardial infarction. This chart shows you the survival rate and what might be happening within the first 10 years of having a myocardial infarction. Take a look at this. If you have problems interpreting it, let me know. But this just shows you what might occur later on, what the later complications are, what earlier complications are, and what percentage of people are still alive 10 years after a myocardial infarction. Prognosis depends upon many factors. Speed at which medical attention is received is very important. A suggestion that some people have given is if you or a loved one that you're with feels they're having a heart attack, unless otherwise indicated, take an aspirin, thin the blood a bit if nothing else is available. Okay, check with your doctor before and make sure that this might be valuable for you to do. All right, so you can look at this. Diagnosis and severity of a myocardial infarction is indicated by the type and level of certain enzymes found in the blood. And these are troponin and tropomyosin. These enzymes indicate, if they are elevated, that a person has in fact suffered from a myocardial infarction of some degree, because it indicates damage to the muscle fibers of the heart muscle, of cardiac muscle itself. Coronary artery stents can be put in to help an occluded vessel. They look kind of like little mesh screens, almost mesh tubes inserted into the coronary artery. Sometimes this works, sometimes not, depending upon the level of damage to the heart and to the vessels. Or coronary artery bypass surgery, in which generally an individual's other vessel, piece of another vessel, is taken and then used to graft to the non-occluded portions of the coronary artery and form a clear passageway. One of the problems with this is, unless a person's lifestyle changes or unless they're under proper medication, even the bypass graft can become occluded again. Risk factors are here. I've mentioned them before. Treatments for cardiac disease, I mentioned aspirin, but again, ask your physician. Some physicians recommend a low-dose aspirin, 81 milligrams every day, but it might be contraindicated with other hemorrhagic conditions. So check with your health practitioner. Don't just do it. All right, here's some more treatments for heart disease. You can read about these. I want to finish up this with a little bit of review about congestive heart failure and what it is. And I want you to go to Moodle and take a look at these following videos, which will clarify. And I want to spend a moment on sickle cell anemia. It is a genetically transmitted disorder. Approximately 10% of African Americans have the sickle cell trait. Having the trait, which means one allele for this disease, one recessive allele for this condition, does give people a resistance to malaria. So think about why that would have been effective to people whose ancestors lived, genetically evolved for many millennia in the equatorial regions. But sickle cells themselves do not efficiently carry oxygen, do not efficiently carry hemoglobin, and you can see they form a sickle cell kind of crystalline shape, which can actually interfere in the capillaries and cause severe tissue damage and severe pain. Notice that there is ischemia due to these more fragile blood cells which tend to clog small arteries. It cannot be cured, and blood transfusions and fluid replacement can expand blood volume and help oxygen exchange. There is some more information about sickle cell anemia posted for you this week, as well as the video. So please go to Moodle and look at these. If you have any further questions, this was a quick overview. Most of it is very clear in the textbook and in the readings that I have provided for you. If you have any further questions, don't hesitate to message to me. And again, I wish you a successful studying of this unit. Chat with you later.